My name is Gerald Callaghan. I'm a neurologist here at the NeuroMedical Center. The Deep Brain Stimulation program, known as DBS for short, is a program we're very proud of here at the NeuroMedical Center. It is a very exciting treatment for patients with movement disorders. We do this procedure for two main diseases. We do it for Parkinson's disease and we do it for essential tremor. We do have some unique features about our Deep Brain Stimulation program. We have always done the procedure with frameless technology. So we do the procedure in about 90 minutes compared to most places where it takes 4 to 5 hours. For essential tremor, if there's two medicines we try, if that doesn't work, then they're eligible for the surgery. For Parkinson's disease, there's 3 scenarios where patients are candidates for the procedure. The first situation is the most common, where patients are taking their medicines for Parkinson's for years, and the medicines work well for a while. After a number of years, the medicines start to wear off in between doses, and patients can get these dyskinesias, these fidgety, squirmy movements. And so when people start to have these on and off fluctuations and or the dyskinesias, that's when DBS is a great option. And 2 other situations for Parkinson's are some patients have a really big tremor, high amplitude tremor, and those are very difficult to get rid of. It takes very high doses of medicines that often are not feasible to maintain. And then finally, the third category would be patients who are very sensitive to the Parkinson's medications and they can't take enough medicine to adequately treat their symptoms. We see all 3 varieties of those patients who get DBS here and are very successful. Every patient who goes through our program, they get detailed neuropsychological testing to rule out dementia and also to rule out severe anxiety or depression. We have all the tools in place here. We have the neurologist, we have the neurosurgeons, we have the neuropsychologists, we have nurses, we have physician assistants, nurse practitioners, people behind the scenes too, even people doing forms, people getting the insurance approval, helping them get their medicines, battling with the insurance companies. We do all that here. It's nice to be a part of such a great neuroscience center, some place with, such great multi-specialty physicians that are able to collaborate on a treatment like this. So the first step would be patients would get their head shaved completely, and then we put these 5 little tiny screws in the skull under local anesthesia, so people just feel pressure, and they get a CAT scan with the screws in, and then they go home, and then early the next morning they come in for the main surgery where we put the wire in the brain. And for that procedure, that's the one they're wide awake the whole time. They're taken to the surgical suite and we start getting everything prepped and draped. We give numbing medicine over the skin. We drill a little hole in the bone and it's about that big, and people just feel vibration and pressure. They shouldn't feel any pain because we use a lot of numbing medicine. And then we set up this, and this is the device that we use to precisely guide the wire into the brain. When the wire gets to that part of the brain and the patient's awake, it makes a certain sound. And when we hear the sound, then we do a test stimulation. I'll be there with the patient, I'm interacting with them, and I do a test stimulation to make sure their tremor and other symptoms go away. And then also they have to be awake to tell me if they're having side effects. We check the speech, the vision, they tell me if they're having tingling. All this helps us determine that we're in the right part of the brain. After this part's done with the stimulation, we do put them to sleep briefly for 10-20 minutes with propofol, but then they wake up a short time later. They do spend the night in the hospital for observation purposes, and then they go home the next morning. And then about a week later, patients get the battery surgery where they get the battery implanted in the chest. They are under general anesthesia for that surgery, but they go home the same day. And that surgery, we implant the battery in the chest wall here or here, left or right side usually. And then there's also in that same procedure, there's a connecting wire here that goes from the back of the ear all the way down under the skin and plugs into the battery. So that's 3 surgeries. And then a few weeks later, we do the first 2 surgeries all over again for the other side of the brain, where we, shave the head, we put the fiducial screws in, and the next day we do the surgery where we put the wire in. They stay in the hospital overnight, and then they go home. And at that point, they've had all 5 surgeries. All the hardware is implanted, all the wires and the battery are implanted, everything's ready to go. And about a week after that last surgery, they come to see me in the office, and then I finally turn it on. Some people, especially people with essential tremor, they can get immediate results from the very first programming session after the surgeries are over. I mean, as soon as I turn it on, literally the tremors can be gone completely and instantly. Those are very exciting and dramatic. For other people, especially with Parkinson's, sometimes it's a little more of a process. We have to slowly ramp up the settings over time, and at the same time we're ramping up the DBS, we're lowering the medicine. So we're trying to replace the medicine as much as we can with stimulation. Patients and the doctor have full control over the programming. There's a smartphone that is given to every patient that has an app, and the app controls the battery, so patients can turn it up, down, off, on anytime they want. So they have full control, so they shouldn't have a stimulation related side effect. There's people that are finally able to do the things they love, fishing, shooting, hunting, just typing, writing, eating, drinking, going out to eat without embarrassment, going to a family dinner without embarrassment. Some people have even voice tremors and they can't even talk or communicate. So there's people that really get their life back. They're able to be social again. They're able to participate with all kind of activities at work and socially, and have much higher quality of life. One of the big advantages of deep brain stimulation versus some other kind of surgeries that can be done to treat these conditions is that DBS can be turned up over time. So after we do the initial programming, we get them optimized, they're doing very well, but months, years pass, conditions worsen, symptoms come back a little bit, and at that point we can turn it up and we can keep up with the symptoms as they progress. We can keep turning it up. But there does come a point where you can't turn it up anymore, because every time you turn it up a little bit, it stimulates a little bit bigger area of the brain. And once we get outside of that area of the brain that we're stimulating, it can cause a side effect. But they can keep it there for the rest of their life at that setting, at that highest tolerated setting. They can keep it there the rest of their life, and it works very well the rest of their life. But some people after that point have to start going back up on the medicines a little bit. But as long as they keep getting the battery replaced, which lasts 5 to 7 years, then they'll have the advantage, the benefit of the treatment for the rest of their life. And there's even an option now with a rechargeable battery that's very small, by the way, that lasts 15 to 20 years. But there's another non-rechargeable option. People do nothing and it just lasts 5 to 7 years. And then it takes a simple one-day surgery to swap it out and get a new battery. DBS is not a cure for any of these diseases. It's just a really good and powerful treatment that can change their lives dramatically. We take pride in the fact that we go through a lot of steps to make sure patients have the safest and best possible outcomes. We have a team that's the same team that's been doing this for 18 years, 500 or 600 cases. So we have this down to a science, but at the same time, we don't take anything for granted, and we take each patient very seriously and check all the boxes, dot all the I's, cross all the T's to make sure that everybody is going to have safe, good outcomes.